therapy is a way to release thoughts and feelings and be able to walk away from them, but still have the artifact of that experience left behind. But it doesn't have to be perceived as part of me. It can be perceived as an experience that came through me and landed in the art.
Michael Hans, who wrote in the American Journal of Art Therapy, Retrospective Review in Art Therapy, creating a visual record of the therapeutic process, said that art therapy is a unique source as it is able to leave behind a physical and visual representation of a past memory or an event.
One of the cool things about art therapy is that when you make art, your subconscious will come out in the art. And you don't really know exactly why you draw things that you draw, but there are processes that happen.
According to Elizabeth Scott in Art Therapy, relieving stress by being creative. Drawing and art can take your mind off of what's stressing you. It's difficult to keep ruminating on your problems while being focused on creating.
How do you use what the people give you and understand it?
Well, a lot of people think that art therapists interpret the art, that it's kind of part of the deal, but it's really not true. We just kind of try to be with where the person is that made the art. The artist is the one that has the answers.
According to the Yellow Brick, the artist creates and art therapist facilitates the emerging adult's own understanding of what they have made.
Different therapists will have different kinds of clients that they really enjoy or feel like they're successful with, and they'll focus on those. So some people won't see kids, and some people will. Some people see everybody. Because we don't have a lot of art therapists in the Dallas area, I don't limit my population. I see a lot of different ages. However, for the most part, there's always exceptions, but for the most part, I see school age and up.
According to Art Therapy with Adolescents, art therapy can offer a support system to adolescents experiencing abuse or depression. It's a non-threatening way for teens to express themselves.
Gosh, there's a lot of diagnoses. There's all kinds of things, but as far as the kinds of people that kind of gravitate to art therapy, well, let's see. I see a lot of trauma. So trauma would include many things. It could be a car accident that has really caused some fears that are repeating, like PTSD, post-traumatic stress disorder. It can be a history of sexual abuse. I had, physical violence. I find that those people come to art because many times they've tried talk therapy and they just need to go deeper, but they sometimes need the art to be the place where all this stuff goes, and it really helps a lot. So I've seen people really come a long way with it. It's usually incredibly fascinating to see what they would draw, but they couldn't really communicate ideally to really get anything going in therapy for process or healing. But when they would make their art, things would change. They'd become more focused. They would be more expressive. They would be able to talk more with the image as the go-between, the bridge between.
Right.
And so people noticed this, and they started to develop it and work with lots of different kinds of populations using art as a bridge to help move the information internally to externally, and then hopefully become okay with whatever it was going on in the person's life.
Okay.